Okay, well, it's another episode of Khalidia, and we have a special guest today, Dr. Goleen Samari, assistant professor at Columbia University. A number of accolades. Goleen, if you'd like to introduce yourself.
Sure.
Your resume is longer than we need to read, but it has a lot of
Sure.
Yeah.
Happy to. I'm Goleen Samari. I'm an assistant professor at Columbia University's Mailman School of Public Health. I met Khalidia through our graduate program in Islamic Studies. So I have a background in both Islamic studies and public health, and I'm a population health demographer by training. And so I kind of use that combination of training and skills to really focus on social inequities in health when it comes to Middle Eastern and Muslim populations, both in the US and in the region. And so I'm probably most known for my work in that space.
I have sort of an irrelevant question, but what is the mailman part of that? Like, I saw that earlier.
I think they name schools based on donation amounts.
And there was a mailman.
Someone named Mailman.
There was a mailman that donated to the school.
Yep, that is what it is.
Yeah.
Like the UCLA school where I graduated from was the Fielding School because of Jonathan Fielding's donation, so it was named in his name.
Sure. I mean, I get that. I just like is mailman a name, or is that a title?
No, it's a last name.
Mailman?
Yeah.
That's an unfortunate last name.
I mean, there's worse though.
Yeah, I suppose. Hey, we recently talked to Ronnie, and we met Ronnie when we were in Beirut. We lived in Beirut, and as when I was your chaperone and translator.
You were my chaperone in Beirut in what, 2010?
Yeah.
And we met Ronnie. Yeah.
And we met Ronnie, and I also did some data entry, I recall.
Oh my gosh, you remember
for
that we lost that survey data and you helped re-enter it.
Yeah.
At AUB.
Yeah. So I lended a hand.
Yeah, you sure did.
In any case, so we go back a long ways.
Yeah, more than a decade.
There's a lot of history there. But it'd be nice to talk about what your current research is and what you're working on currently.
Sure. Yeah. So I, as you know, because we go back so far, used to do quite a bit of work focused on women's health. I still do quite a bit of work focused on sexual and reproductive health. But in 2015, when I finished my PhD and was getting started on my postdoc years at the University of Texas at Austin, I noticed that there were a lot of anti-Muslim hate crimes going on that year. In particular, there was a murder of 3 Muslim students at UNC, and then there was the incident with the bomb clock in Dallas, with the kid taking a clock to school and being accused of making a bomb and being expelled. And it just really dawned on me that I was sort of positioned in this place where I had had training from a lot of scholars who had looked at racism and health. And I also had Islamic studies training. And so I was like, I'm one of the few people that's actually able to speak out about why Islamophobia and anti-Muslim racism is really a health issue and a public health issue. So since then, I've had sort of an ongoing line of research in that space. And because the research is so limited, I did like sort of the theorizing and the conceptualization. And now I do a lot of work that really tries to like measure it and quantify and really operationalize it. And so a lot of my current work is really, using tools that we have available to actually like capture what's going on and really show people that it has a health impact. So I had a recent paper that, for example, looked at the 2017 Muslim ban and how it affected women's birth outcomes. And there was a real big increase in preterm birth among the women from the banned countries, which is a terrifying health indicator because we know that that is a predictor of lifelong health and poor health. And so just this one really structurally discriminatory policy had a profound impact on women's health. And so I do stuff in that space, and along the lines of other social inequities in health. So I look at migration-based inequities, particularly in the Middle East and North Africa, and I continue to look at gender-based inequities as well.
So for someone who's not in your field, what do you mean when you talk about quantifying it, and like what is that exactly? For someone that doesn't know anything about that particular field.
Sure. So like a lot of times we talk about like measuring things or, proving things. And in social sciences, we have sort of two ways that we create proof or show associations. And one of them is through quantitative research and one is through qualitative research. And so I do both. Qualitative research is really asking Muslim communities in the US about their experiences with discrimination, what they do to combat discrimination, how it affects their health, how it affects how they socialize in the world. And so it's really bringing those voices forward. On the quantitative front, it's really about different ways of measuring it. So for example, a lot of our hate crime statistics are from the FBI, and they're imperfect because of the way that we talk about race ethnicity or measure race ethnicity. So for example, a lot of Muslim communities are categorized as white because Iranians and Arabs are categorized in the white category. And so the hate crimes, like if you just look at raw hate crime statistics, you don't have a full picture of exactly how many anti-Muslim sort of hate crimes there are. I think it's really underestimated. And so I try to capture like, how can we measure anti-Muslim hate in other ways? And so one of the ways is like scraping data from Twitter, for example. So like, are there periods of time where there's more like hateful tweets? Is there Google Trends data that corresponds to increased hate? Using different tools like that to actually create sort of quantifiable numbers around these things, and then associating them, using statistics to then associate them with various health outcomes.
Here's a question in terms of the quantitative aspects of the research pertaining to Muslims in America. Obviously, we know that there is no set number. We don't know exactly how many Muslims live in America. Because of what you had just stated. We don't know how many Arabs or Iranians or what have you of the different groups are in the country. And so one, how does that affect your research? And two, I mean, yeah, you said you're coming up with other ways to try and quantify data. Is this, which is pretty creative. I mean, that sounds very creative. Is it are you able to use that data in as effective a manner as if you had the actual figures, like official figures?
So a couple of things on this. It kind of goes both ways. So one, you have to be creative because there's no official figures. And even beyond something like the census, which is our closest thing to like an official count. And there was a big debacle with the census data collection in 2020 around Middle Eastern and North African communities. And we can talk about that further, but basically the decision was made not to collect that identifying information. And so what happens is a lot of the survey information, so they take a sample of the population and they survey them. is based on the census racial and ethnic category. So even the nationally representative survey data that we have doesn't really capture religion. It doesn't capture Middle Eastern and North African categories. And so you have to be really creative. And I've used some national data that we have to like do some of my work. But again, you often don't know within the Arab community who is Muslim and who is not. Same thing with the Iranian community, even if you can identify those communities. The other side to this is within these communities themselves, there's a certain amount of vigilance and I don't know, like lack of desire to reveal your identity because of experiences of hate and discrimination. And so on a research side, for me, it's a constant battle between, do I push for identifying these communities? And how do I do that in a way that sort of, there is a certain level of paranoia now in all of our communities about revealing that kind of information, or, you know, it's kind of a 50-50 split about people who want to be on the census versus not because they prefer to be hidden. And so that's a result of the discrimination as well.
Well, I mean, this is not a new, in my understanding, this is not a new situation. Like the reason that Arab Americans are considered Caucasian on the census, they campaigned for it because it was in the 1920s or so, around then, that they, during like Jim Crow laws, that they didn't want to be classified as non-white. So they campaigned to be considered Caucasian, but now it makes them basically invisible on in the census as a distinct community. And then also, like today, I think there's just a paranoia about talking to the government whatsoever and identifying yourself. And I understand the logic for each of those you know, impulses and those movements, but it does make it very difficult to quantify those populations and demographics.
Exactly.
Well, I think,
and that's 100% correct. Like this movement for being included in the white category started really early on, and now I would say the communities are pretty divided. Part of the problem is that their lived experience is that of a minoritized community, right? So most Arab and Iranians and other Middle Eastern groups are not walking around the United States being treated like white people. And so I think that that's where the debate comes into play. And it's really, really tough as somebody who wants to advocate for these communities and have resources allocated to these communities to then not have the official count. But it's also equally respectful to not want to reveal your identity based on the experiences and want to remain a hidden population. And so as part of the respect for the community, I also hold that really, really closely.
well, I have a friend who he's an activist in the Arab community here in Southern California, and any sort of political issue that pertains to the Arab community, he's pretty much at the forefront of that. And so he was very active in campaigning for the prior to the census, the 2020 census, to get those categories recognized. And he was going around the community and informing people and doing all the legwork, right? And telling people that, hey, yeah, we know of the paranoia factors. We know of also some of the issues that people have that they've carried along with them from, you know, a lot of them from countries where they come from authoritarian regimes, right? Where they're terrified of identifying themselves and being monitored by intelligence services and what have you. But what he was saying is that, you know, ultimately this is such a hotly political issue, in that, as you just mentioned, a huge amount of government funds and resources would be dedicated to, let's say, the Arab American community or the Iranian American community or other communities. And those those funds, those resources could be used in so many ways that could benefit those communities. And it seems like, I mean, I can see also from your angle the public health aspect, but then there's so many ways that these communities are held back. And it seems like it's just this concerted effort, to keep doing that. I don't know if it'll turn around in the next census, if things come around, but.
Yeah, it's happened like every census for the last like 30 years. So I was really hopeful for the 2020 round. I thought that it was finally going to go through. And so because of a lot of those grassroots efforts that you're talking about, because of a lot of the information sharing around what it means for resource allocation for these communities. And unfortunately it didn't. And I think it ultimately didn't. There's like 100-page report out of the Census Bureau about, everything they did with piloting these measures, and basically all their evidence shows that it was useful for these communities to have this categorization. And then ultimately it didn't move forward. And I think that was very politically motivated and outside of the research that shows that the utility of actually having that additional category.
Well,
right.
Here's a question outside of the academic world, because I mean that's the orbit that you're working in. How does your research how does that translate into impacting policy?
Sure, it's a great question. So my first realization that this argument that anti-Muslim racism leads to poor health was an academic argument that the public could not fully grapple with was when I wrote the original piece on this in 2016, because I also published an op-ed in order to, a lot of times with like pushing policy forward, you have to not just publish an academic article, like certain people care about that, but not everybody does.
No one reads academic
Right.
articles except for academics.
Right. So you have to publish op-eds or policy briefs and things like that, and really connect then organizations that are doing policy work to your work to move it forward. And so I wrote an op-ed, and then I received the most hate mail and death threats and Islamophobic directed like hatred that I've ever received in my life following that op-ed being published. And my argument is very simple. Like we know that racism affects health. We have decades of research in the health space that shows that. Muslims are people too. And so racism against Muslims affects their health as well. That's the whole argument. And the public could not get on board with Muslims are people too. That piece of the argument really was triggering for a lot of folks. And my family received hate. The FBI had to get involved. We had to stop checking our mail. It was quite a fraught situation, but a learning experience for me, which is that the academic argument is one thing, the public opinion argument is another thing, and then the policy effort actually involves taking all of that collective information to organizations that are doing this policy work, both at the local levels, because even in states, we have like anti-Sharia legislation. And one thing I look at, for example, is, states that have more like anti-Sharia bills being proposed and passed versus states that have less, and thinking of those states that have more as more hostile towards Muslims, and using that sort of structural information to look at Muslim communities in those states and their health outcomes. And so there's a lot of policy effort that can take place at multiple levels, and a lot of it is getting the research in the right hands or partnerships with organizations that are doing the policy work.
Well, you're up against a lot of morons.
Yes,
like anti-Sharia laws, it's like you don't even know what that is.
Exactly. I have to always explain to people like where that
like
movement
what Sharia
growth.
is.
Yeah. I was
what
like,
it,
that
what it
doesn't make
even
any sense.
means, and
Right.
and no one's imposing this on you. And don't worry, the Taliban is not in your neighborhood.
Yep.
Calm the fuck down.
Exactly.
Well, there is something I wanted to ask, which is, I mean, obviously your focus is on the US, but clearly there are a lot of similarities in other parts, like other Western countries, the UK, the Netherlands, what have you. Are you seeing
France.
that France, of course, yeah, of
Yeah.
course. Are you seeing that, there is more possibility for the kind of work that you're doing, and the things you're pushing for here as opposed to Europe? And like, what are the similarities? What are the differences that you see?
Yeah, so a lot, my work is really moving in a sort of comparative direction, I would say. So bringing in some additional country context, comparing. A lot of the theoretical work is applied now. People who are sort of extending my work are looking at European contexts and how they vary or confirm. I have collaborators, for example, who focus on Australia as another case. So it's both moving in the comparative direction, I would say, like also in the demographic age group. So like, what are the implications for youth and the elderly? And so thinking about it like that too. So it's going to be a lifelong effort, I think, but for sure, Islamophobia is not limited to the US. I would say China and India are like global leaders in Islamophobia. And so that it's important to really kind of continue to elevate that it's a global phenomenon.
Well, when we talk about, the health aspects of, or the health impacts of Islamophobia, you mentioned a great example of women from because of the Muslim ban, women from those countries having preterm births. What could you give I know there are probably like so many different kinds of impacts, but could you give the listeners some kind of idea of like other health impacts as well?
Yeah, so we have quite a bit of work in the mental health space about the impacts on mental health. So everything from depression to anxiety to psychological distress and things like that, to even issues with like identity formation and internalizing stereotyping that we see connected to mental health issues as well. So a lot of work, or a growing body of work, has been done on the mental health impacts. On the physical health impacts, we have a little bit less information, which people are always sort of more hungry for. Like we see some evidence of impacts on heart disease and hypertension, some evidence of impact on chronic conditions like diabetes, and then a lot of impacts on health behaviors. Like if you experience discrimination or racism, you're less inclined to engage in like healthy health behaviors and healthcare seeking behaviors. So going to the doctor, getting advanced health screenings, accessing healthcare, feeling comfortable with your physician, like those types of things. So when I talk about health impacts, I'm referring to collectively all of those things: mental, physical health, health behaviors, and healthcare access and utilization.
Have you looked into do you have any data on vaccination and the Muslim community or the immigrant communities? Like, does that affect? Because I feel like, there's different levels of paranoia about vaccinations. Do you think there's something specific to this, to these demographics?
I would love that data. If you have that data, please give it to me. There's a lot of speculation that, and I've seen, quite a bit of talk, not quite a bit, a little bit of talk about how, because we do not have the racial and ethnic data again on these communities, that we don't know anything about vaccination rates and vaccination uptake. And again, this is why that race ethnicity data is really important, because the Muslim community, the Arab community, the Iranian community, these communities are not the targets for vaccination programs and uptake. And so we could be missing a whole segment of the population that is not vaccinated or under vaccinated and has vaccine hesitancy, and we have no targeted programming because we frankly don't know anything about their vaccination rates. And so it's a huge, it shows exactly why this is a problem.
So they're just kind of slipping under the radar.
Yep.
Oh.
Exactly.
I wanted to ask a little bit about some of the research that you've been doing pertaining to the Middle East, North Africa region. And when it comes to refugees and migration patterns, and how all that impacts people's health, just to give also give us an idea of like an overview of what your research about that is.
Sure. So I am faculty in the program on forced migration and health at Columbia's Mailman School. And that program was originally founded after Rwanda and really is known for training sort of the next generation of humanitarian sort of aid workers. And so as a result of that, very active in refugee communities throughout the world and drawing attention to issues of forced migration and health and refugee health. And so it's both like an honor and privilege to be a part of that program because even before coming to Columbia, I was focused on Syrian refugee health, given that the crisis has gone on for well over a decade now. So my work in the region originally focused on extension of sexual and reproductive health services to refugee women and girls. I would say it's evolved to a lot more than that because, for example, they've been in Jordan in a protracted crisis kind of situation now for a number of years. It's gone beyond sort of emergency response and getting people sort of their immediate healthcare needs and into a like long-term and protracted response effort. And so I look at things that range from, you know, engagement in education, or like how are Syrian children being provided education and what are the implications of that for their health and well-being. And I look at things like what are the decision-making sort of determinants for people to continue migration onto Europe? Like what prevents them from doing that? I've looked at the employment sector, for example. So, but I come at these things looking at them in the way that they intersect with health. So yeah, it's a whole range of research projects in the region, a lot, mostly on the refugee experience in both Lebanon and Jordan.
Yeah, I mean, there's so much that could be done with that. That's such a huge, like, broad, yeah, just a field, really. It's almost like a field of its own, it seems like. One of the things that I've always been curious about, and we've talked about this before, but I saw with my own eyes at a Lebanese refugee camp. It was, you know, Syrians who were at this refugee camp in Lebanon, was the amount of kids that the refugees were having, right? And one of the things that was being talked about a great deal was, well, you know, they're in this really difficult situation. Why are they having so many kids? And they were talking about, well, there were activists who were trying to reach out, and I don't know if it was the UN who were trying to educate or inform the refugees about like birth control methods and all that. So being a host population, dealing with very few resources, and, you know, obviously it's a political issue when you have millions of people, like refugees in your country. But at the same time, and this is something I also read from what you, like one of the things that you had written or was interviewed about was that a lot of the refugees in those environments are coming from areas in Syria where they have high fertility rates. So
yeah,
you know,
This is one of my
getting
pet peeves. So the narrative is often that refugees come in and have a lot of children, and the same narrative has been applied to the Syrian refugee case, but it's actually like a data anomaly. Like if you look at what the fertility rates were before migration, it can give you greater insights into, like, migration is not triggering higher fertility. There was actually like a pre-migration fertility rate that was elevated amongst a lot of the communities that refugees originated from. So actually, if you look at the fertility distribution in Syria before, you see that they're coming from high fertility areas. So I actually think the impact is quite a bit less than people make it out to be. That said, there's quite a bit of literature also on the impact of disasters like hurricanes and earthquakes on fertility rates, and they are often elevated in response to disaster.
So I think, yeah, Hussein said that we should maybe stop so that we could start a new recording so that it
we have a
works
time,
better
we
with
have
the
a time
editing.
limit on what we can do with 3 people on Zoom. So
Okay.
So let me end this and I'll send the link out. I'll just email you the link, Goleen.
Perfect.
All right.
See you
Thanks.
soon.
Let me start recording as well. Okay, so we're back. So yeah, on that last point, I wanted to continue and pick your brain a little more.
Sure.
So the issue with refugees and the politicization of, you know, the high fertility, obviously that comes with the territory. It comes with a whole number of other things that host countries might sometimes throw at refugee populations. You know, so many different issues come up, and then you know that creates tensions and all that. I've seen it before when it comes to the Palestinians in Syria. I saw it with Iraqis in Syria. Now we're seeing it with Syrians all over the place. So it's pretty common to see those things. But in terms of fertility, one thing that I did think about, and you know, it seems that you've done some research about this as well, is the issue of, like, in those communities that a lot of these refugees come from, the idea of like gender norms and how the wider community, like what kind of structure they have, that I don't know exactly how to say this, but what kind of structure these communities have in terms of women reproducing and, you know, their agency and what have you. If you could, you know, give us some of your thoughts on that.
I think when we talk about gender norms and sort of household dynamics with regards to gender and women's power and things like that, we really have to situate it in the community and the community level norms when we discuss it. Because, for example, with the Syrian case, there's this discussion of like, oh, after forced migration, the gender norms were changed because women were getting more jobs. Okay, so first of all, there was a lot of men who died like as part of that migration. Particularly, there's a big sort of gap in what we call the population pyramid. If you look at like sort of 24 to 33-year-old men who, you know, either were left behind in Syria, died, or have been separated from their family unit. And so when you talk about, you know, after migration, these women became heads of household and they got jobs. I mean, that's a contributing factor. Like if you're forced to be the breadwinner, you're going to be the breadwinner. But is that a transformation of gender norms, or is that like a result of socioeconomic circumstances? The other piece of it is that it's really driven by work permit availability in places like Jordan, for example. There's work permits available for very specific sectors, and some sectors are more appealing to women, and so then the women would get the jobs because that's where the work permit availability was. So I think that a lot of times when it's not contextualized and we just talk about like who's making the decisions in the household and what the household norms are without thinking about the larger both socioeconomic and social norm structure that's potentially driving those things, is where some of these problematic narratives arise. Now, issues like gender-based violence and just violence against women, I mean, I think that you have to consider those factors as well, but again, contextualize them in some of the sociocultural norms while also making sure to elevate women's voices in a culturally appropriate and socially appropriate way.
One thing I came across, and I don't know how much research you do with regards to refugees, let's say Syrian refugees or refugees from the region who went to Europe. But and this is hearsay. This is based on any research or data collection or anything like that. But that there were a lot of cases in which there were families who fled and ended up in Germany or in Sweden or somewhere, and they come from communities where in Syria where women weren't allowed to work or weren't allowed to go to school beyond a certain point. And so being in Europe is a completely different experience, right? Where the host countries expected these women to go to school, at least to learn the local language, right? To learn a trade, to be productive members of society. And with that came that eventually they were able to make incomes for themselves, and that created a lot of tensions with their spouses and what have you. And so I heard that there were a lot of divorces that were happening, people going, like families splitting, men going back to Syria. It was just a mess. And so
that's very classic. That's classic. That's why some of the early sort of women's economic empowerment programs failed and ultimately led to increased gender-based violence in the household, because they would they would come in and microfinance the women and give the women the opportunity to start these small businesses, which is great in theory, a good idea in theory. But if you don't think about the household dynamics, you're just like interjecting a new power structure into a household that's unaccustomed to it and not having enough sort of a multi-level approach that involves the spouses, I would say, and then ultimately creating more problems. So it's anecdotal, but it aligns, the evidence that you're presenting aligns with sort of what we know about some of those early microfinance and economic empowerment programs targeting women.
Well, what I first thought of when I was thinking about that is, yes, there are a lot of issues, at least when we, as let's say someone who's from Syria, right, looking at Syrian society, whether it's during the conflict or pre-conflict, there are a lot of issues pertaining to women and the advancement of women, right? Of course, I understand that has to be done in a particular, I guess what the right word is would be like cultural context, right? And I definitely see the need for that, and I see that not just in Syria but in other parts of the region as well. But then my question is, what are your thoughts on approaching something like that, these dynamics, when at the same time it's a double-edged sword? You want to balance between that intention, let's say, and this whole like white saviorism, if we want to call it that.
Yeah.
Which is a huge problem. And now it's I love that people are talking about that a lot more now. That's very common to hear about.
But we know, like, know some
especially when
basic
it comes
things.
to women.
Right. We know about how family-oriented communities in the Middle East and North Africa are. Like, we know how community-oriented they are. And so there's decades of research that shows that you have to approach those contexts in a way, first of all, that's community informed. And so, for example, when I wanted to do research on Syrians in Jordan, they were like, the issues that are most important to us are education, employment, and social protection. So one of my research projects focused on those three dimensions because that is what the people said was important to them. And so you have to use that community informed approach, even with women's issues too. And then also approaching something from a family aspect versus an individual women's empowerment aspect is very different. And so there's a lot of spousal interventions. There's a lot of like, the concern is largely for these households with, a different power dynamic than what we're used to in Western societies, for lack of a better way to say it, is that the concern is about the children. And so if you solve the issue of the children's schooling, for example, or the children's life trajectory from schooling to employment to, some path that they're going to be set on, then the stress on the parents is reduced and it helps balance that sort of household power imbalance. So there's a lot of different ways to approach it that where you're not coming in and like saving the people. I mean, if you think you're coming in and like saving communities and saving people and have that sort of white savior mentality, then you shouldn't be doing this work, like, period. Like, that's it. Like, it's just the wrong way to approach it. And I think that we're reaching a point, at least in the humanitarian space and with the humanitarian development sort of nexus, that increasingly there is an understanding of how to do this work appropriately. And now it involves some creative thinking for communities like the Syrians who have been in now protracted displacement for such a long period of time. It's like, we need to be solution oriented and the refugees need to be at the table when we're coming up with those solutions.
I think, I mean, in any situation, it's always, it's necessary if you want a good solution to listen to the people on the ground and ask them what it is that you need. Like, what do you need? And I think that's part of the work that you're doing. If I'm going to throw a difficult question at you, which is, judging from the research that you've done and your knowledge of the situations, do you have a vision of, like, if you had the power to wave a magic wand, what do you think the most important things to be done would be? Would you swing your wand on and make happen?
I can speak to this on, for example, for Syrians in Jordan pretty easily. I think it involves an educational trajectory, guaranteeing an educational trajectory to higher education that then links to jobs. And I would create a work permit structure that works to create actual job opportunities and career trajectories for Syrian families and the Syrian community. I think that a focus on return migration is severely flawed. And anybody who thinks that that is a viable development pathway needs to think through it a little bit further. And that's a really controversial thing to say, but it's truly, I think if you listen to the Syrian communities, you'll hear that front and center. Nobody is planning for return or framing it as return is the ultimate goal. The only reason they're forced into that perspective is because their needs aren't being met in the host communities that they've now lived in for a long time.
Well, why is it controversial?
Because I think part of the development sector thinks that that's this, okay, so now there'll be this great return, like all the displaced Syrians will now want to go back, but we know why that
Well,
nothing has changed with
who's objecting to it?
who's on the side of that's not
Yeah.
viable. I think anybody who's researched the situation.
Well, I mean, I could say just from a personal sort of perspective, having like knowing people who are refugees, Syrian refugees, and knowing that they don't want to go back. There are many reasons, including, well, is the situation in Syria going to actually turn around, even if a political settlement is reached? How do these people know if they're going to be targeted by the regime or not? Is there going to be, I mean, why would anyone leave a place that has the security and safety, maybe more opportunity, at least in Europe, than let's say in Jordan or Lebanon, to go back to Syria? It's so I think
Also,
that there's definitely a divide in people, like, not realizing just how bad things are in Syria, and that they're not going to turn around if a political settlement is reached.
Also, like, let's take it from the health standpoint, since that's where I approach things. You're talking about people returning to a country where the healthcare infrastructure has been completely demolished and the healthcare workforce has largely left. So even let's ignore every other aspect of somebody's life. Why would you go somewhere that you literally cannot get healthcare for you or your loved ones, including the elderly, including children? There's no doctor to see you. And now there's been a global pandemic that's gone on for 18 months. So I think that's front and center in people's decision making. And so part of the work, one of the research projects I'm engaged with right now, is looking at how healthcare factors into these return decisions. And it's largely that it sort of pushes people, they know that the healthcare infrastructure has been destroyed. They know that there's not doctors there for him. And then think about that across sectors, like it's not just in healthcare. So there's really no incentive system to go back.
Well, we did a recent episode on Lebanon, and I know that now there's definitely a medical brain drain going on in Lebanon as well. And so, it's similar patterns, and not just in terms of like the actual staff, doctors, nurses, what have you, but even medical supplies and pharmaceuticals, that all of that is severely lacking. And so, yeah, I think that it was Denmark recently said that they wanted to send a bunch of Syrian families back, that they said, oh, things are better now in Syria. And so it's unbelievable when you have governments saying this. It's pretty crazy.
Yeah, from a host community government standpoint, I mean, I think view it as they've struggled with this for over 10 years now, and that's an easy solution, right? And so it's a matter of showing, and the research on return, like what are some good examples of return migration that we've historically seen? There's very few, like maybe the Balkan case, maybe parts of maybe there's some return in Iraq. Like there's barely a good case of this. And so it really, I don't know, it's really interesting that people kind of default to that as the easy answer, where in my mind we have no proven track record of this working ever. So why would it work now, particularly in this situation that's politically, socially, economically fraught in so many different ways?
Yeah, I mean, there isn't a clean solution to it. I mean, I think people would love to return to their homes if their homes even exist at this point. But, the amount of, destruction that's happened in these places, there isn't a place to go back to. So you're dealing with diaspora and migrant communities. I think that generally the international community should be a little bit more sympathetic to the fact that migration is a natural part of human history. Like we've had mass migrations in the past, and we need to just deal with it and find the best way to deal with it. What do you think?
And we saw with COVID that the impetus, or like people's propensity, was really to initially blame migrants and immigrants, and now we're circling back to that narrative again. And it's like, we know COVID affects everybody. Like, you're not getting COVID from an immigrant more so than you're getting from your neighbor, your child, your family member. Like, it's interesting that the reaction to COVID initially was to, close borders, and they used public health guidance to justify basically closing borders. And for example, Trump era policy that was put in place that asylum seekers couldn't seek asylum at the US southern border has been held up by the Biden administration. It's Title 42. It's really not founded on any sound public health guidance at all. It's just a decision that
solved any problems.
It's just a decision that, migrants are vectors for disease, and that's how people want to think about immigrants and migrant communities. And that's like a huge global, it's a problem everywhere.
Well, I mean, if we're going to do that, we should build a wall around Florida.
Well, let me ask you this though. I mean, to play devil's advocate a little bit, when you look at a lot of the migrants who move from place to place, like let's say whether it's in Syrian migrants or migrants from Latin American countries trying to come to the US, typically, and this is something we've seen also here in the US, not just amongst like migrants or recent migrants, but vaccination efforts or rates, let's say, are typically or have been typically lower in let's say Latin and Hispanic communities, right? And so part of the I think the argument is that, well, some of these people or a lot of these people may come and not be vaccinated or not want to be vaccinated, or I don't know what the extent of the reasons or factors are, but what would you, if you had a magic wand and you could deal with this situation, right? How would you approach this from a public health standpoint?
I think we need to do a lot better, and there is a movement towards this about community-based vaccination campaigns. I would disagree with the premise that any ethnic or racial community is to blame for their low vaccination rates. I would say that people doing the vaccinations are to blame for not reaching out and educating and going into those communities and really talking about vaccination. We have really good examples of when, just having like a street fair where you like one-on-one talk to people about the benefits of vaccine, how vaccine uptake increases from that personal interaction. And there is efforts from the Biden administration currently to engage in those community-based efforts to increase uptake. There's also millions of doses of Pfizer and Moderna that are going to expire at the southern border by the end of this month. And we could easily have a policy that opens up access to those vaccinations for some of the migrant communities at the border or peering at the border. We've done a pretty terrible job, I would say, as a country, helping vaccines get distributed around the world. And quite frankly, this disease will not end until global vaccination rates are higher. It doesn't matter who you are, where you're from, you need to have access to vaccines, and you need to make the choice to get vaccinated in order to actually see an end to this pandemic. And so it's really sad to me when you see millions of doses of a vaccine go to waste at a border, and that option is not given to communities just because they're migrants or seeking asylum or whatnot.
I think it was on the Young Turks the other day, was they were saying how the rest of the world must view the US and Americans as monsters because we hoard all these vaccines and we don't use them. There are so many people who don't want to get vaccinated, and yet we refuse to, you know, send these vaccinations out so that someone can benefit from them. So it's terrible, as you put it.
I mean, the fact that something like a vaccine becomes an object of ideology is the problem. Like, that is the major problem in terms of vaccination, is that you make it an ideological point, and it's not. And, you know, fuck all you guys. Like, you've been vaccinated. Like, do you have polio?
Yeah.
Have you've been vaccinated for polio and tuberculosis? You were vaccinated before you were even, you know, conscious as a decision-making person. And vaccinations work. We know they work. It's something we've been doing for a century or more than a century. So, you know, the idea that you make it a point of ideology and make it questionable, it's like, well, what about all the other vaccinations that you've had?
Also, the point of like making it available to a select few and not others because they're migrants or they're not because of racism. Like we saw in the, you know, Israel is often elevated for its high vaccination rates, but there's
except for the territories,
except for the Palestinians. So there's a whole discussion that could be had there. And it's like, you not giving your neighbor access to vaccinations is ultimately not going to help with your COVID rates because you're only doing as well as your neighbor is doing. So
I think that's been a common theme with this whole COVID situation, just in general, not just with vaccines, but just with everything else. It's like, you know, we can't keep living the way we have been, where we just focus on our individual selves and our own individual well-being as people, as communities, as a country. You know, it's just that keeps coming up. And now they're talking about the booster shot, and that they want to get that, you know, rolled out. And the WHO was telling rich countries to hold off on that before they could send out, you know, vaccines to poorer countries so that more people could get vaccinated first. So it's for how much longer can this keep going? It's interesting. And yeah, Israel, you brought up Israel, they're at the forefront of that booster shot. It's like, well, your neighbors haven't even been vaccinated fully yet, and you're already trying to roll out the booster shot for your people.
Not only did the Palestinians not get vaccinated, but the Israeli occupation force in the West Bank actually blocked and shut down vaccination spots.
And they destroyed the one vaccination center in, what was it, the one COVID center in Gaza.
Yeah.
And Israelis who were in settlements, in illegal settlements, were offered vaccinations when Palestinians weren't. So there's many different dimensions of that issue that I think often don't get elevated, and there's quite a few really important advocates, I think, doing work in that space as well.
But how do you go ahead?
Well, I think there are some issues that should be recognized as transcending borders and boundaries and politics and global pandemic, and battling that is something that everyone needs to put down their sword and shield and get rid of their ideology to deal with this, and then we can get back to fighting if you want.
Right. Well, I agree, but I also think it's like, I think I think framing it as racism is really helpful sometimes, because some of these issues, like issues at the southern border, the Palestinian and Israel issue with vaccinations, like there's an element of racism, and not to go back to like anti-Muslim racism or anti-Arab racism, but I do think it's a big component of
No,
what
of
we
course.
see. Yeah.
Of course. And there's it's sort of soft ethnic cleansing.
Yeah.
Of like, we'll let you languish, and we'll let you die of these diseases.
Well,
It's,
how do
go ahead.
go ahead.
No, you go for it.
How do people like yourself, Goleen, in academia or in the nonprofit world or in government, how can the policies be changed with regards to this issue of vaccination, specifically vaccination when it comes to COVID? Because this isn't some issue, like some distant issue that we can talk about and hope that that governments change their policies on. This is something that's urgent, and it could eventually become, if we're going to talk ideologically, right, in terms of like the way that governments, or the manner that governments speak, and the lingo that they understand, it could become a national security issue. So what is the, in your mind, like the best way to approach this to actually change policy?
So we approach it, so public health in a pandemic has obviously been like elevated as a field and a discipline, which is good and bad. So it's bad because I feel like the communication around the public health communication around the COVID-19 pandemic will be studied for decades, if not a century to come, because there was many areas of it that were severely flawed. The benefit is that many in my department and my school, and myself included, have had the opportunity to be involved in, as cheesy as it sounds, highly effective task forces that are involved in decision making around these things. And so with direct lines to decision makers and policy makers on the sort of forefront of the decisions that you see out of, the White House, the CDC, and things like that. And so even we've written, for example, numerous letters that have gotten quite a bit of media attention, and then ultimately the attention of government officials, for example, around the Title 42 that I mentioned, with using public health, like ill-informed public health guidance to shut down the border to asylum seekers, which is required by international law. We've also, for example, pushed for vaccination, equitable vaccine distribution globally. And so those things, like signing on to those things as academic leaders in the public health space, actually has an impact when you have a collective sign-on of several hundred people, including deans of your major schools of public health. And so these are ways that we've been able to push forward some of the policy decisions that we want to see. And also, a lot of the faculty of schools of public health are on the decision-making teams or the task forces or the policy-making groups that are like actually making these decisions. So sometimes it's a matter of finding the right person and just being like, hey, we should really not let millions of doses of vaccine expire at the border. That seems like a really poor decision. So there's people, for example, that I know that are specifically working on that issue to prevent that from happening. And so we hope that it changes things by the end of the month.
I don't think anyone from the public health community or the medical community would disagree with you. I mean, it's politics. It's purely bullshit politics that are getting in the way of something that should just be a purely health situation. And it's like, if we can, you know, raise taxes on tobacco and, you know, make other public health situations, which I'm not a fan of the taxes on tobacco personally, but that's my own vice.
Sounds like a personal issue. Yeah.
That's a personal vice. However, if we can get those things done, we can get vaccinations, and we need to like take the politics out of it. It needs to be an apolitical issue, and just, it's science, it's health, it's for all of us.
I agree completely. I think that it was this pandemic and the response to the pandemic was politicized early on because of the previous administration, and unfortunately that has just snowballed, and every public health decision has become a political decision on the right and the left. And it's really been sad to see, honestly, because I think lives are lost as a result.
I mean, I think we can without qualms point a finger at the Republican Party in the United States, and it's infectious, because you see, like, we're seeing mimic behavior in other, you know, countries, and like Bolsonaro in Brazil playing the Trump game, because they saw how it worked, and it was successful, you know, to a large degree. So you see regimes sort of copying that and turning everything into a, you know, some kind of political issue, when really it's it shouldn't be a question.
No, the border closures, the nationalist sort of approach to governance, and the far right-wing movement around the world it's all reflective, either informed the Trump administration or now really reflects it as well. And so it's terrifying for anybody who is a person of color, is of a minoritized group, is of any sort of non-majority status. It's actually terrifying to move towards that form of governance on a global level.
Or if you just give a crap about human rights.
Right. Yeah, exactly. Exactly. If you care about people and one another and the rights of those people, then you should be really alarmed. And that's why a lot of my work falls into what's called like socio-political determinants of health, because I'm constantly thinking about these larger scale governance issues and trying to raise the red flags about, hey, we should all be worried about these trends, like look how damaging they are, and it's not just here, it's all over the world.
Mm-hmm. And instead you have dumbass Republicans like just spouting nonsense. And you know what I mean? Like I'm not saying this as someone who cares about the Democratic Party either, because they don't impress me that much. But the Republican Party has become very malignant and
disturbingly so, to their own demise, to their own detriment, to their own mortality. Like it's bizarre. It's completely bizarre.
Denying science, denying logic, and even when it's against their own interests.
Yeah.
So, well.
Yeah.
So if you want to weigh in on that?
I mean, I agree. I agree completely. I couldn't say anything different. It's pretty shocking what's been going on, and yeah, it doesn't make any sense logically in any way, you know. And it, like as you put it, Goleen, for someone who is of a minority background, it is terrifying. Yeah, that's a very, very good way to put it, just to see all this nationalism everywhere. But yeah, we could go on for hours. There's so much to talk about.
But I think anyone with a sensible mind would not disagree with us. We are winding down.
Yeah.
I think we've covered a lot of good territory here.
Do you have any final questions?
We could question you for all, for another like 2 hours, but I don't think that this session
It'll drag a lot.
like
So
we gotta portion this thing out. So
Makes sense.
we don't have enough room in this session, and we have about 1 minute left before it's going to time out on us anyway.
Awesome. Well, thanks for having me. It's been a pleasure talking to you both, as always.
thanks, Goleen. It was really great having you.
Of course. Of course.
Dr. Sabzi. It's nice.
Yep.
It was nice to see you.
You too.
Maybe we'll talk again soon.
Definitely stay in touch. Send me good vibes as I enter parenthood.
I'm
Good
sure
vibes
you'll be
sent.
just fine.
Yeah,
Thank
no,
you.
you'll be great. You'll do great.
All right.
Thank you. All right. Talk to you both
Talk to you.
soon. Bye.
Talk to you later.
Bye.
Bye.
Everybody.